From the KPFK studios in Southern California,
it's the Ralph Nader Radio Hour.
Stand up, you've been sitting way too long.
Welcome to the Ralph Nader Radio Hour. My name is Steve Scrow, and along with my returning co-host, David Feldman. Welcome back, David.
It is an honor to be back.
It's good to have you back, and we have the man of the hour, too, of course, Ralph Nader. Hello, Ralph.
Hey, how are you? This is going to be a titanic issue to 2020 elections.
Yes, we hope it is. And what Ralph is referring to is we've got a couple of doctors on the program today. One is an MD, the other a PhD. And first up is Dr. John Geyman. He is back with us to discuss healthcare. Regular listeners remember Dr. Geyman as an advocate for Medicare For All. He has done a deep analysis of Obamacare versus Medicare For All, as well as the Republican alternative, whatever that turns out to be. And I believe I'm going to give him credit for coining the term Trumpcare. Trump, I think, owns the healthcare system now, and he likes to talk about how people don't want to give up their quote unquote beloved private health insurance. And I believe this is the first time the word beloved has ever been used to describe private health insurance. And of course, this is the same guy who said, who knew healthcare was so complicated? He said that after taking office, by the way. So Dr. Geyman's new book is entitled Struggling and Dying Under Trumpcare, How We Fix This Fiasco. That's the first half of the show. In the second half of the show, we turn our attention to the art of persuasion. We welcome Dr. Ben Burgis, who is the author of a book entitled Give Them an Argument, Logic for the Left. It's sort of a handbook on how we take apart the logic of the right. And David, you've actually read this and talked to Dr. Burgis, right?
Yeah, it's really interesting because a lot of people on our side don't know how to fight back. We kind of just listen and then walk away. So it's very valuable information.
And in between, we're going to break up our two doctors with a man who could get his own doctorate in exposing corporate crime, our corporate crime reporter, Russell Mokhiber. And you podcast listeners won't want to miss this week's wrap-up. We're going to talk to David Helvarg, the head of Blue Frontier, the advocacy group for ocean conservation. He has a new proposal called Putting the Blue in the Green New Deal. So we'll get to that in the wrap-up. But first, let's talk about how we can fix the fiasco of Trumpcare. David?
John Geyman is an MD and Professor Emeritus of Family Medicine at the University of Washington School of Medicine in Seattle. As a family physician with 21 years in academic medicine, he has also practiced in rural communities for 13 years. Dr. Geyman has served as president of Physicians for a National Health Program and is a member of the National Academy of Medicine. His new book is entitled Struggling and Dying Under Trumpcare, How We Fix This Fiasco. Welcome back to the Ralph Nader Radio Hour, Dr. John Geyman.
Well, thank you. I'm glad to be here. Thank you for inviting me.
Welcome again, John. Seems like we're old friends now with so many interviews and my promotion of your various books, which are very, very clearly written, listeners. And you're well advised to read these books because this is going to be the big issue in the 2020 presidential and congressional campaigns. Are we going to continue the present corrupt, constant denying, profiteering, cruel, inefficient healthcare industry system? Or are we going to have a simpler, more efficient, single-payer system with free choice of doctor and hospital, no networks, and, of course, better outcomes as a result? So let me start with the big deception here, because there are some people who don't like to use the phrase Medicare for All because of the sabotage of Medicare by the Republicans and Democrats in allowing more and more of Medicare recipients to be seduced and deceived into what's called Medicare Advantage programs, what I call Medicare Disadvantage. And we now have 1 out of 3 elderly people under Medicare drawn in by these deceptive promotional lunches that the health insurance companies have all over the country, where they have presentations that should be prosecuted by the Federal Trade Commission. They're so deceptive. In your book on page 21, you have a pretty devastating summary of why people over 65 should stay clear and just go into traditional Medicare, not go into Medicare so-called Advantage. Can you tell our listeners why? they should avoid Medicare disadvantage, as I call it.
Well, I agree. It is Medicare disadvantage, and they have all kinds of deceptive marketing approaches, as you mentioned, Ralph, including one that isn't talked about much, but they have these marketing pitches on second and third floors of places without elevators so they can pick out people that can handle stairs. They're always trying to get healthier people and make as much money from them as possible. Meanwhile, they have restrictive networks that change all the time. Even docs can't keep up with the latest changes. Sometimes a doc doesn't even know if he's in or out of network. They can change so rapidly. And all these pre-authorizations. And no, it's just a total rip. It's an example of why we don't need the private multi-payer insurance industry anymore. It's ripped us off for a huge number of years, not just privatized Medicare, but privatized Medicaid. And then overhead of these private insurers runs about 6 times what traditional original Medicare is, of about 2.5%. So this huge overhead. And right now what we're seeing is the private insurers more and more fighting back for their expanded place in healthcare, including buying up more and more physician groups so they can run them, etc. So
it's a corporate takeover. I don't use the word privatized, John. I use the word corporatized. So basically, Medicare, so-called Advantage, is a corporate takeover, and all the abuses that people who are under 65 are exposed to with health insurance companies operate here. They deny benefits. They're wasteful. They require you to go only to a certain network of doctors and hospitals, even though they may not be proper for your ailment. It's what Dr. Fred Hyde in Connecticut once told me about Medicare disadvantage. He said, it's not what you pay, it's what you get or what you don't get. It's what you don't get. Stay with traditional Medicare, even though they require the traditional Medicare patients to subsidize the Medicaid and Medicare health insurance companies. And just to give you an idea, Centene Corporation, this is in Dr. John Geyman's book, Struggling and Dying Under Trumpcare, How We Can Fix This Fiasco, just out. And it's also online. Centene Corporation, the largest private Medicaid insurer in the country, took in $1.1 billion in profits between 2014 and 16, just in California, even as its plans were among the worst performing in the state, end quote. That's another way of saying they're expert in denying benefits and underpaying what's required, often turning patients away in desperation and even making more money. Now, you're enthralled by one bill in the House of Representatives. And explain that. Give the bill number. I think it's fair to say it's the best single-payer bill, better even than John Conyers' bill and Bernie Sanders' bill. And it's supported by a lot of Democrats. So give the vital statistics about that bill, starting with its number.
This is H.R. 1384. It's in the House. It's expanded and improved Medicare for All. It's a great bill, the best we've ever seen. Its 2 leading co-sponsors are Pramila Jayapal from Seattle, actually, and Debbie Dingman from Michigan. This will bring us a new system of national health insurance for all U.S. residents based on medical need, not ability to pay, and on a principle that health care is not a privilege but a human right. It'll bring right away universal access to health care for U.S. residents, full choice of providers and hospitals anywhere in the country, no restrictive networks, covers everything: outpatient, inpatient care, laboratory diagnostic services, dental, hearing, and vision care, prescription drugs, reproductive health, including banning the Hyde Amendment so that women can have full reproductive health care, maternity and newborn care, mental health services will be a lot better covered, including substance abuse treatment and long-term care and supports. Some of this is absent in Bernie's bill in the Senate. Quite a bit of what I just said is absent. There's no cost sharing, such as co-pays and deductibles in the House bill. They'll negotiate drug prices, as the VA does to get, and has for years, to get prices down to about 58% of what we pay. It'll be huge administrative simplification with negotiated fee schedules for physicians and other health professionals who will remain in private practice, global budgeting of individual hospitals and other facilities, and bulk purchasing of drugs and medical devices too. That's a big deal, the medical devices. If you've had a hip replacement, you know that the cost of that can vary a lot wherever you are in the country. The House bill will eliminate the private health insurance industry with its administrative overhead and profiteering, and no longer need for employer-sponsored health insurance. Cost savings, we've got two great studies we can talk about later if we need to, that enable universal coverage through a not-for-profit single-payer financing system.
Mm-hmm.
Two great studies, as I said, one just 6 months ago. 2-year transition period actually for the House bill. 1 year after enactment, people over 55 will be so covered, and under 19. After 2 years, everyone's covered. Shared risk for the cost of illnesses and accidents across the whole population of 326 million. So it is really a good bill. 70% of Americans support it, including 85% of Democrats and 52% of Republicans. So,
and I might add, when people have access to health insurance, they don't postpone needed health care, which either ends up destroying their lives or disabling them and losing their jobs, or they inflict even more costs on the healthcare system and Medicaid, et cetera, because they didn't have the money to afford health insurance under the present system to get diagnosed and treated in time.
Yep.
So where the present system has this perverse incentive of feeding on its own waste and rejection, this system goes in the opposite direction. It catches medical ailments early before the cost becomes 10 or 100 times more as the ailment becomes more and more serious, whether it's respiratory disease, cancer, or what have you. You know, when I hear you say all this, John, my first reaction is, why in the world is the USA, the last Western country, years and years, that doesn't have universal health insurance? All other countries, Iceland, Luxembourg, Italy, Germany, France, England, Canada, Taiwan, Japan, you know, it's not just Western countries.
Yep.
And we know it's because when Lyndon Johnson had a chance to go for Medicare for All, the country was spending huge amount of money in the Vietnam War. And there were members of Congress who were saying, President Johnson, you can't go cover everybody. We can't afford it because the Vietnam War is draining us and there's inflation. So that's another cost of imperialist wars, by the way, because as you quote in your book, there's a government study out in 2012 saying that 45,000 Americans die every year because they can't afford health insurance and therefore can't get diagnosed and treated in time. Well, that's almost 1,000 people a week. And if you multiply that by 40 years or more since the end of the Vietnam War, that's over 1.7 million people who could have been saved. So, and the second response I get to this when I hear you speak is that the supporters of full Medicare for all, everybody in, nobody out, free choice of doctor and hospital, better outcomes, and half the cost per capita. That's the experience in Canada. And unless we think Canadians are a lot smarter than we are, they have modern healthcare, they have the equipment, they come in at half the price per average per capita, and they cover everybody in the country. Where, as you point out in your book, about 30 million people under Obamacare are not covered. It's getting worse. And about 80 million people are underinsured. And we still spend twice on the average per capita of Canada. But the supporters of S-1804, which is that great bill you describe in your book, I submit, don't know how to argue very well for it. They're already put on the defensive by people, Republicans mostly, say, how are you going to pay for it? It's going to be multi-trillion dollars a year. Tell us the many easy ways to pay for a system that once it's in place costs half as much as the system costs today in dollars and doesn't kill anyone because nobody dies in Canada or France because they can't afford health insurance. They're insured from the moment they're born.
Yep. As just one example of the Canadian advantage over us, if you're an auto manufacturer in Toronto, they pay very little compared to what a U.S. car manufacturer has to pay for health care for their employees. But yeah, if we bring it down to people and budgets, which we should have a system that cares about people instead of corporate profits and Wall Street investors. But anyhow, the average family of four today with employer-sponsored health insurance pays $28,000 a year now for insurance.
Good heavens,
and health
$28,000 a year.
$28K. But then the median income in the country is something like $59K. So this is just absurd. And if we compare that with national health insurance through Medicare for All, 95% of Americans will pay less in taxes than they do now for insurance and health care through a progressive tax plan. I'm going to mention these. We've had two studies, both of which show huge savings. The Friedman study of 6 years ago or so told us we could save $616 billion a year by going to Medicare for All. That includes $220 billion through insurance overhead and administration, getting rid of that, etc. Lots of administrative savings. Then the second study is more recent and is very well done. The Political Economy Research Institute out of the University of Massachusetts in Amherst. This reported out just 6 months ago that total health spending will increase from $3.2 trillion to $3.6 trillion due to many people getting care they previously had to forego, but will save $5.1 trillion over 10 years through savings from our getting rid of the multi-payer profiteering private insurance industry. So we have solid numbers and different ways of progressive taxation. The Perry study out of Amherst, they would set business premiums at 8% below what a business now pays on health care. They would set a sales tax on non-essential goods of 3.75%. They'd put a recurring tax of 0.36% on all wealth over $1 million, and they would tax long-term capital gains as regular income. So there's a lot of work that's been done, but the opponents of this are gathering momentum again like they always do, including hospitals that are saying, oh, we might not get paid as much as we are. Well, they'll get paid better, actually. Insurers, of course, are complaining because they'll be going away.
They have to be replaced. You can't have a single payer government funding, private delivery of health care, and still have private health insurers like Aetna that in 1 year recently paid its CEO over $55 million. 1 year.
Right. They'll have to be replaced. The way I like to think of it is the winners and losers under Medicare for All, single payer. The winners are all Americans. Physicians and other health professionals will win because they'll have much less bureaucracy. They'll have more time to take care of patients. That's why they became such. Hospitals will win. Employers will win big time. Mental health care will win. Mental health care is very underfunded. It'll be better reimbursed. Public health will win. Federal and state governments will win, and taxpayers will win. The losers are private health insurance, corporate middlemen, corporate stakeholders, privatized Medicare, as you said, disadvantaged Medicare, Ralph, privatized Medicaid, displaced workers. Well, there's a plan in the House bill that allocates 1% of its budget over the first 5 years for assistance and retraining of workers displaced by elimination of the private health insurance industry. And that's probably 1.7 million people. So there are big numbers there.
You know, if people are still skeptical, Take a look at some of the reports on the pricing of healthcare services in this country. $3,000 in Berkeley to take someone a mile and a half to a hospital in an ambulance. $3,000. There are operations in the U.S. for $100,000 per operation that in Canada are done at $25,000. You have massive billing fraud. Minimal estimate this year, $350 billion in the U.S. That's about what the whole healthcare system in Canada for 33 million people costs. You have far less billing fraud. People don't even see a bill in Canada for the most part. None of the anxiety, the dread, the fear, the insecurity that pervades millions and millions of families in the United States. You can't put a dollar figure on that, can you? And there are all kinds of ways. You tax corporations at the level they were taxed in the 1960s. That'll produce hundreds of billions of dollars. They were making a lot of money in the 1960s. The 1960s were one of the most prosperous decades, and they're grossly undertaxed. A lot of these corporations aren't taxed at all. 56 major corporations in this country paid no federal income tax whatsoever last year and got rebates. They so gamed the system. For years, General Electric would make billions of U.S. dollar profits, pay no federal income tax. So the ability to pay is everywhere by just making a more just political economy, having the rich and the multinationals not escape taxation by putting illegally their profits in some little island off the Isle of England or in Luxembourg or in Ireland. It's just amazing that the supporters of this bill, John, don't know how to make all the arguments. Like I've heard a dozen members of the House support this bill. They never mention that it would prevent 45,000 deaths a year. And of course, many more injuries and illnesses because people will be able to afford health care and they won't be denied because they couldn't afford health insurance to get diagnosed and treated in time. They never mention it. I haven't yet heard anyone mention that it will save hundreds of billions of dollars in fraud. I haven't heard anyone mention that no longer will the drug companies be pursuing the sky is the limit and hit a patient for $100,000 or $150,000 for a year's treatment when you can get it for 5% of that in Egypt, the exact same drug, because they control prices in Egypt and other countries. What do you think's going on here? The Republicans argue without the facts forcefully, and they use all the non-factual arguments, the scare tactics, the lies. The Democrats don't use their full panoply. They don't use their full menu of arguments. Therefore, they're on the defensive in the House of Representatives. Why?
Yeah, I want the Dems to stand up. And we do have a progressive wing. There are 107 co-sponsors in the House bill, the Geyman bill. They're a major force. We have to listen to them. And some of our enemies are our own Democrats in the center who still take credit for the Affordable Care Act, which has failed after 9 years to control prices. It helped for a while with getting people covered, but we still have 30 million uninsured and 80 million or so underinsured. So it had no price controls, never intended. It pleased this coalition of profiteers, corporate profiteers, but that's not good enough. So
I think you touched on the answer to my question.
Yeah.
If the Democrats in the House make the full arguments for single payer, full Medicare for all, they are in effect condemning all the holes and all the escape hatches and all the profiteering allowed under Obamacare, which is under attack by the Republicans who want to repeal Obamacare. Well, they can't have it both ways. We need a clean sheet here. Too many people's lives, too many people's anxieties, too many people's livelihoods are at stake. Here's another eye-opener, listeners, in Dr. Geyman's book. By the way, have you been invited to testify in the House of Representatives? They now are controlled by the Democrats. They've had hearings on single payer. Have they invited you?
No, I've had.
You've only written about 8 books on the subject.
Yeah.
a practicing physician, an
Yeah.
academic professor of medicine at a well-regarded medical school in Washington State. Why aren't they inviting you? How can they be authentic?
Well, I think we just touched on it. There's too much cowardice politically across the Democratic spectrum, and the centrists are running things more than they should, and that's bad. We've tried incremental little tweaks to the system for years, and they don't work.
They don't work because the corporate lawyers for the health industry know how to game it.
Right.
The corporate industry is ripping off Medicare, $60 billion with a B a year, listeners. That's your money. And ripping off Medicaid in the tens of billions of dollars every year. That's your money. Here's a quote from your book that ought to open up the eyes of all our listeners whose ears are already open. Quote, the federal government now pays about 60% of total health care costs in this country, a much higher figure than most people realize. Much of this has been ongoing subsidies of the private health insurance industry, which receives $685 billion in government subsidies each year, and the Congressional Budget Office projects this number to double in another 10 years, end quote. So they're already spending more of your money than would be necessary to support a single-payer system, which comes in at half the price of what you're paying now under the corporate system and the government subsidy system. So I think we're not going to get this bill through the House, much less the Senate, unless there's a real informed 1% of the people out there who summon their senators and representatives to town meetings and thrash it all out and send them back with their instructions. 80 years of dilly-dallying since before Harry Truman was president are enough. Would you agree that we need town meetings back where you are, where your two senators and representatives have to answer up and get educated by you and others?
Absolutely. And it's interesting. I'll say two other points right here. In 1912, Teddy Roosevelt ran as a progressive for national health insurance, and it's been shut down politically over all these years since then, but it's not a fringe idea. The other thing, we get all kinds of reasons by the coalition, corporate coalitions against Medicare for All, one of which it'll be too disruptive. Well, I can tell you I was in practice in a small town, Mount Shasta, California in 1965. When Medicare came in, it wasn't disruptive at all. So
one point you make in your book on page 177 is if you have full Medicare for all, you're going to have more primary care doctors, and there won't be this incentive to go immediately into specialized medical practice. And you point out that having more primary care for patients is a great preventative approach, not just treatment approach and diagnostic approach. You say access is more available and efficient, getting primary care, receiving more preventive services. Costs are better contained with strong primary care. Quality and outcomes of care are improved by primary care. Primary care provides better coordination and integration of care, and you spell it all out. You got to get this book, listeners. How do they get the book? Because I want to ask you one last question. What's the difference between Obamacare and Trumpcare, which is the title of your book, Struggling and Dying Under Trumpcare, How We Can Fix This Fiasco, by Dr. John Geyman of Washington State. How can they get this book fast and have discussions in their living rooms and town meetings back home and really start a rumble? So when the members come back for the 4th of July recess from Congress and they take off a month in August, they get some real citizen heat and citizen light, and they get back with their orders.
They can get it on Amazon right away. They can get it through bookstores. It's out there.
Okay. And also online, probably. You don't want to give it all the business to Amazon, right, John?
No, it's online, sure.
Right. How do they get it if they want to get it from you? What if they want you to autograph a copy? Would you do that for them?
Well, of course I would.
Because you're a great figure in American medicine, and you get almost no press.
I have a website, johngeymanmd.org. so they can find out more on all that.
That's Geyman, Geyman.
.org, yeah. JohnGeymanMD.org, yeah.
Have you been on NPR or PBS in recent years?
No.
There you are. I'll bet you they've had 100 cosmetic surgeons dealing with vanities of men and women on hundreds of times.
Yeah.
How do you contour the nose that's pointed upward, doctor? What an insane system of media priorities, isn't it? I just finished an article that says the worst is first and the best is last. And I give all kinds of examples. Even in sports, the highest paid players are very often nowhere near the best players. But even in politics, in book writing, in movies, in the professions, often the worst practitioners are the highest paid, and the loving, serving practitioners, like serving needy, poor patients or going over to Africa and dealing with the Ebola crisis, they hardly get paid a living wage in the United States. So what are you going to do about that? We have to have millions of people listening to what you have to say and reading your book. Maybe we can get some advice from Steve Scrovan and David Feldman.
Yes,
What about it?
I'm chomping. Yes. I think you, Ralph, you let doctors off the hook. I can't get a straight answer from doctors. There are only 152 some odd medical schools in this country, and doctors have no right to play the victim in all this. Why? You could solve this problem overnight. Doctors have to stand up and say, this is unacceptable. We have a disease in this country. It's called our healthcare system. We're not going to practice medicine unless it's fixed. We're not going to work for these health insurance companies. We're going to go on strike. Why aren't we targeting the 150 some odd medical schools in this country who receive federal funding? There are fewer medical schools than there are congressmen to target. I'm sorry, this is infuriating.
Think there should be more medical schools?
I think there should be more medical schools, but if you want to get universal health insurance in this country, it's the doctors' fault. It's their greed. They could stop it in a second.
Is it the doctors or the American Medical Association or both? What's the answer, Dr. Geyman?
Well, the AMA has been against national health insurance forever. Actually, it's interesting, a little side story. In 1917, they had a social committee in the AMA which came up with, we need something like national health insurance, and they sent that out to the state chapters, which all came back, no way, ever. So that's one little side thing. But yeah,
It's like talking to an alcoholic. It's like talking to an alcoholic and addressing all the issues other than the drinking. If you can't get the doctors on board, it's not going to happen.
Well, majority doctors already, David, in poll after poll, are for single payer, about 55%, higher percentage for nurses.
Yeah, I mean, so it's their fault.
What do you say?
It's our organizations that are the problem because they get bought off. But yeah, exactly right, Ralph. Most positions and other health professionals, especially leaderships by nurses, is strongly for Medicare for All.
You have real touching examples in your book about how people, because they couldn't afford a certain procedure, ended up worsening in their condition and dying. This is America, land of the free, home of the brave. What's the difference between Trumpcare and Obamacare before we conclude? Dr. John Geyman, author of the brand new book, Struggling and Dying Under Trumpcare and How We Can Fix This Fiasco.
Well, Trumpcare is much worse than Obamacare. The GOP and the Trump administration has sabotaged Obamacare, but Obamacare wasn't fixing all of our problems anyhow. And the Republicans still haven't come up with a health care plan, and they won't.
Actually, Trumpcare took millions of people off Medicaid. Can you explain that?
That's exactly what they've done, and they want to hand over through state block grants the responsibility for Medicaid state by state. Well, a lot of the states cut it back to almost nothing. In Alabama, I think if you have a family income much over $3,000 a year, you're not eligible, stuff like that. So
it's as if Trump is telling the poor, let the poor die. They don't vote for him anyway.
That's what it is.
Well, Dr. John Geyman, the chief sponsor of your favorite bill in the House, H.R. 1384, is Congresswoman Pramila Jayapal. And
Yes.
she comes right from the district near where you live.
Right.
Are you going to ask her to invite you to testify in
Yes,
the
I
next
will.
hearing?
And I have been in touch with her and sending her the book and the pamphlet and, of course, all that, and thanking her for her leadership, et cetera, et cetera. That doesn't mean I've been invited.
Well, if you do testify, you'll have all kinds of reporters crowding around, interviewing you, and you'll reach the national media.
Yes.
Thank you very much for all your good work, Dr. John Geyman, the author of the brand new book, which you can have, called Struggling and Dying Under Trumpcare, How We Can Fix This Fiasco. And he doesn't let Obamacare off the hook one bit either. Thank you, John.
Thank you for having me.
We have been speaking with Dr. John Geyman. We will link to Struggling and Dying Under Trumpcare, How We Fix This Fiasco at RalphNaderRadioHour.com. Now we're going to take a short break and check in with our corporate crime reporter, Russell Mokhiber. And when we come back, we welcome first-time guest Ben Burgis, who's going to tell us how to argue with right-wingers. Back after this.
From the National Press Building in Washington, D.C., this is your Corporate Crime Reporter Morning Minute for Friday, May 24, 2019. I'm Russell Mokhiber. Health Canada, the governmental agency responsible for public health, is charting a new course when it comes to dietary advice, particularly in the area of sugar substitutes. In a significant departure from the past as well as from the U.S. approach, Canada's new food and dietary guidelines released this year say zero-calorie and low-calorie sugar substitutes are neither necessary nor helpful. That's according to a report in the Washington Post. Sugar substitutes do not need to be consumed to reduce the intake of free sugars, the guidelines say. The new Canadian approach seems to be that if a food or beverage doesn't have a demonstrated health benefit, it doesn't belong in your diet. New York University's Marion Nestle agrees. Personally, I follow a food rule not to eat anything artificial, so these sweeteners are off my dietary radar. For the Corporate Crime Reporter, I'm Russell Mokhiber.
Thank you, Russell. You know, a lot of people on the right fancy themselves as eminently logical. In fact, one of the most widely read libertarian magazines is called Reason. Well, our next guest is going to tell us how those of us on the left can fight logic with logic. David?
Ben Burgis teaches philosophy at Rutgers. He is the author of a new book entitled Give Them an Argument, Logic for the Left. It's published by Zero Books, which produces a YouTube channel that also features Professor Burgis. You can also see him every Tuesday evening on The Michael Brooks Show. Welcome to the Ralph Nader Radio Hour, Professor Ben Burgis.
Thank you. It's great to be here.
Welcome indeed. Now, you're known in Rutgers circles and around the country as a hard-boiled logician driven by cold reason and facts and not deterred by emotion. So how come you dedicated your book to, in your words, my beautiful wife Jennifer, among her many virtues, she's the best logic instructor I know, end quote?
Because it's true. I would also point out that one of the things I do try to argue in the book is that Star Trek got it wrong. There really is no conflict between logic and emotion. You know, it's entirely possible to care deeply, for example, about pursuing political and economic justice and also think carefully about how to achieve those goals.
How do you like that, David?
Yeah.
I didn't hear a laugh, David.
No, I'm listening.
All right, let me ask you some side questions before we get into a couple areas dealing with how you deal with Ben Shapiro and Nate Silver.
Yeah.
MSNBC fancies itself as a liberal network in contrast to the Fox cable outlet. And yet they never invite, with very few exceptions, progressives like Jim Hightower, Bill Grider, me, even Mark Green. Rachel Maddow doesn't want to be anywhere near a progressive. You think there's a legitimate distinction to be made between liberals and progressives, given that you describe yourself as a thinking person's Marxist?
Yeah, I would make a distinction between liberals and leftists, that I think that kind of MSNBC liberal like Rachel Maddow, really what you get, the message you get from them is this kind of technocratic centrism, that political problems come from people just not having being too ideological, not thinking hard enough about the sort of technocratic, wonky solutions to them. That's why Obama spent his whole first term trying to pursue a grand bargain with Republicans, because he thought if everybody could just get over all this ideology, then they could just, reason together, and they could figure out, how to slash entitlements and allegedly save Social Security and all that stuff. And that's very different than the kind of left-wing values that I care about.
Okay, so let's segue right into one of your most powerful points. You quote Nate Silver, who for years was the analytic pollster and analyst for the New York Times on national politics. And I guess he was pretty much in favor of Hillary Clinton, because he said on more than one occasion, and you quote this in your book, Give Them an Argument, Logic for the Left. Nate Silver says, quote, Clinton and Sanders voted together the same way 93% of the time, end quote. And, to someone who doesn't know much about the facts of the two politicians' record, that's pretty impressive argument that Hillary Clinton's pretty left. And then on page 78, you say 93% is misleading. Here are some of the votes on which Hillary Clinton differed from Bernie Sanders. 1, the war in Iraq. Sanders voted against the invasion. Clinton voted for it. 2, a long series of votes to continue funding for the war, which Sanders opposed and Clinton favored. 3, a long series of trade deals, which Sanders opposed and Clinton favored. 4, the Patriot Act. Sanders voted against it. Clinton voted for it. 5, reauthorizing the Patriot Act. Sanders voted against it. Clinton voted for it. Guantanamo Bay. Clinton voted for a bill to force President Obama to keep the facility open by blocking funds for the transfer of detainees, and Sanders voted against it. 7, the bank bailout. Clinton supported the bank bailout. Sanders opposed it. Now, why doesn't Nate Silver pay a penalty and reduce credibility for pulling off something like this?
Well, he certainly should. If pundits ever had to pay a penalty and reduce credibility, he might. It's also worth noting that a lot of those votes, obviously the list you just rattled off shows that not every vote is equally important, right? Even if those had been the only ones that voted differently on, that would still establish some pretty profound ideological differences. But a lot of those votes don't even make it into his factoid because they happened when Bernie was in the House while Hillary was in the Senate. So his factoid only takes into account the 2 years they overlapped in the Senate. And my favorite part of this is like a textbook example of how to mislead people with statistics, is that during the 2 years that they overlapped in the Senate, Hillary Clinton was running for president. So presumably she wasn't showing up to the Senate every single day to cast votes.
Well, as a logician, you are peculiarly sensitive to the misuse of language, are you not?
Well, I think that's an important part of making good arguments, which is what I'm pushing.
So why do you call longtime prisoners in Guantanamo detainees?
I'm just using the standard words, but I do see your point about that.
And why do you call social welfare services for the poor entitlements?
Well, again, those are the standard terms. Now, I would point out that whereas entitlement has been the word entitlement has been toxified by right-wing propaganda on this point, there's nothing intrinsically wrong with the idea that people are, in fact, entitled to these things. They paid into them. They are entitled to benefit from them. Even if they hadn't paid into them, they would just be entitled as human beings to have a decent retirement and all of that sort of thing.
Yeah, because Social Security and Medicare, people pay into them, and they're called entitlements. Yet hundreds of billions of dollars of corporate welfare, bailouts, handouts, giveaways, subsidies, the corporations didn't pay anything for them, and they get it all free. And that's called incentives. Why a Marxist like you uses capitalist words to shoot yourself in the foot is beyond my comprehension. What's your response?
Well, I think that you need to pick your battles about whether to spend your time arguing about words in every single paragraph or whether to communicate to people the language they already understand while trying to make what you see as the larger argument.
So you don't believe in Confucius, the ancient Chinese philosopher, who says if you don't have the right language, you can't get to second base? That's before baseball.
Yeah, I was going to say I'd be very surprised if Confucius used a baseball metaphor.
Well, let's get to something else that fascinated me in this book, which some people may find a bit hard to read, but they can pick and choose. And it deals with 34-year-old Harvard law grad, fast-talking right-winger Ben Shapiro, who thinks he can argue everybody into oblivion on a stage in front of an audience. Before you start dissecting his techniques, briefly, because we don't have that much time, would you debate Ben Shapiro, and would you predict the outcome?
I would absolutely debate Ben Shapiro. Ben, if you're listening, I'm down for that. And I would predict that the outcome would be that he would do what he always does, which is talk loud and talk fast and try to bulldoze through the substance of what's being said. But I hope that somebody there calling him on it in real time and showing and explaining exactly where his arguments go wrong might make at least some of his more thoughtful followers think twice.
Is he afraid to debate people generally? He just likes to stand on the stage and engage in soliloquy?
Yeah, he likes to debate 19-year-olds who don't really know what they're doing, who ask him questions and Q&A on college campuses so they can use some progressive language in a faltering way, and he can yell at them and, again, kind of bulldoze through what they're saying, and then somebody could make a little clip of it to put out on YouTube. Ben Shapiro destroys another snowflake liberal on campus.
Tell us about his techniques briefly, what he gets away with, and how the New York Times praised him in a glittering profile.
Yes.
Quite apart from his vicious attacks on Palestinian Arabs, which is quoted in your book. It's a clear example of anti-Semitism against Arabs. How does he get away with this in the New York Times? And what's his technique? He's making huge speech fees.
Yeah. So again, I think that a lot of Ben Shapiro's shtick is just that he's very loud, he sounds very confident, he talks very quickly, so you don't have time to stop and think about what he's saying. And in fact, if you look at his book, he wrote a little booklet about how to argue with leftists and destroy them, which is, of course, a very overblown title. But if you read the book, the vast majority of it isn't really about how to make good, careful arguments, which is what you care about if you want to get to the truth. It's about how to rhetorically frame the arguments. Despite this, though, the New York Times had an article about him, which should embarrass everybody involved with it, called The Cool Kids Philosopher, where they referred to him as the destroyer of weak arguments, which is really striking because if you read that article, they only give one example of him allegedly destroying a weak argument, which is he's doing one of his typical Q&As on college campuses. A 22-year-old girl raises her hand and challenges his position on transgender people's rights. And he says, "Oh, how old are you?" And she says 22. And he says, "Oh, could you just identify as 60? And she sputters for a second because it takes her a moment to sort of think of what to say. And then he just sort of starts ranting at her, which, of course, if he actually cared about getting to the truth of the matter, about carefully thinking about it, then he'd pause and let her collect her thoughts so he could say, oh, is this really a good analogy? Is being transgender really like being 22 and identifying as 60, or are those two different things? But he doesn't want to pause to give people time to think about stuff like that. As to the Palestinian issue, where, to be clear, he actually has a history of advocating literal ethnic cleansing. He has an article that he wrote where he says that all Palestinians, not only in the occupied territories, but even in Israel proper, should be, he says, peacefully deported from the country. And he's since then disowned that, but in a very half-hearted way. You know, like he said, oh, that was dumb, but he still opposes the existence of a Palestinian state, and he still opposes certainly giving Palestinians voting rights in Israel. And if you oppose both of those things, then you're saying that this is a group of people who should be kept as a permanent underclass without basic legal or democratic rights.
In fact, you quote, the title of his article is, quote, "The Radical Evil of the Palestinian Arab Population," end quote. And he says the Palestinian Arab population is rotten to the core, the most evil population on the planet. And he's still regaled in the New York Times? I mean, when is this guy going to get his comeuppance by people like you who can nail him to the wall, invite him to Rutgers, and dispatch him on the stage with your pure logic, reason, and ability to demolish his hateful, racist, bigoted articles and views, because he's had a history of downplaying poverty, racial injustice, thinks the massive wealth gap between white and black Americans doesn't have anything to do with racial injustice. Yeah, a person on the left would never get away with stuff like that. Can you have the student forum invite him to Rutgers? This will be a showdown in New Brunswick, New Jersey.
I think it's a fantastic idea. And yeah, clearly this tells you something not only about what's wrong with Ben Shapiro, but what's wrong with American media culture in general, because what you can get away with saying about Palestinians and other Arabs is clearly way out of sync with what you can get away with saying about other groups. That level of open racism, if directed towards almost anybody else, would certainly stop somebody from being positively profiled in the New York Times. And it's absurd that it doesn't stop somebody from being positively profiled in the New York Times when it's directed against Palestinians.
He's been on a lot of media. Have you been on PBS and NPR for this book?
No, I'd like to be, but I have not.
David, you suggested that we have Ben Burgis on, author of the new book, Give Them an Argument, Logic for the Left. You have any comments or questions?
Yeah, I was wondering if the fault is with the moderators of these shows, because in the adversarial nature of a trial, we can get to the truth. And yet we don't see that in debates where there are no moderators enforcing penalties against logical fallacies. Why aren't they improving debates? Ralph, you had the taboo debates, and I noticed that even you didn't have somebody throwing flags down on logical fallacies.
You're referring to the website debatingtaboos.org, David, where we had 4 subjects that really aren't debatable. They're sort of tabooed, like anti-ballistic missile defense, which is a phony, unworkable $14 billion a year project by the Pentagon. And we did debate whether anti-Semitism against Arabs is worse than anti-Semitism against Jews in the United States. And we had a very civil debate with 2 people on each side. And you can decide for yourself, listeners. Go to debatingtaboos.org. But I think it's more than that, David. It's that university and college campuses are often dead zones intellectually. There's no ferment. People come and talk, and most of the seats in the auditorium are empty. People who have serious, dramatic, controversial issues that don't happen to be in the news, like the sexual harassment issues are today, don't even get invited anymore. I remember speaking at Rutgers, and they were hanging from the rafters. At Princeton, hanging from the rafters. At law school, hanging from the rafters. And the conditions then were nowhere near as bad as the conditions are today for tens of millions of people, and the expansion of empire and the domination of global corporations over almost every enclave of life in America. So it goes right back. The students are not demanding serious speakers. They like Seth Meyers and other comedians for whom they pay huge lecture fees. So
right,
what do you say about that, Ben? What's the situation? What's the climate at universities these days? Am I incorrect?
I was going to say, if they want comedians that can pay huge fees, they should invite David Feldman. But in any case, yes. I think there is some truth to that. I think that it's probably has a lot to do with increasingly prevalent idea that the purpose of a college degree is just sort of credentialing for the job market to get skills that, that will please employers, which really de-emphasizes the idea that it's a positive good in itself to sort of spend a few years learning to read and think and, sort of devoting yourself to ideas, which is something that both makes college campuses less interesting. And it's also important to talk about because I think one of the goals of the left that is talked about now more in the last couple of years is everybody being able to go to college, right? That we want tuition-free public universities. And I think that if we're going to do that, we really have to think about how we're going to sell that, to make a good, honest argument for it. because it can't be that, oh, if everybody goes to college, then everybody will get a good middle-class job and it'll solve economic inequality, because the more people who have that credential, the less it's worth in the job market. That's just how supply and demand works. So if we're going to make an argument for it, we really have to make an argument for the positive good of going to college, the positive good of getting to have that enriching experience and, learning to read and think in that way, and, do things like go to see controversial speakers and get excited about that.
Well, listen, we're out of time, Ben. We could go on and on. I hope you get other media. I'll certainly recommend it. We've been talking with Ben Burgis, who is a professor of philosophy at Rutgers University, New Brunswick, New Jersey. He's the author of the new paperback, it's not that long a read, called Give Them an Argument, Logic for the Left. Thank you very much, Ben Burgis.
Thanks, Ralph. It's an honor. I voted for you twice.
Thank you.
We have been speaking with Ben Burgis. His book is Give Them an Argument, Logic for the Left. We will link to that at ralphnaderradiohour.com. I want to thank our guests again, Dr. John Geyman, Professor Ben Burgis. For those of you listening on the radio, that's our show. For you podcast listeners, you're in for a treat. Stay tuned for the bonus material we call the wrap-up, where we not only continue our conversation with Dr. Geyman and Professor Burgis, but we also talk to, as a bonus, ocean conservationist David Helvarg, who you'll hear him talking about putting the blue in the Green New Deal. A transcript of this show will appear on the Ralph Nader Radio Hour website soon after the episode is posted.
For Ralph's weekly column, it's free. Go to nader.org. For more from Russell Mokhiber, go to corporatecrimereporter.com.
And Ralph's got 2 new books out. The Fable, How the Rats Reformed the Congress. To acquire a copy of that, go to ratsreformcongress.org. And To the Ramparts, How Bush and Obama Paved the Way for the Trump presidency and Why It Isn't Too Late to Reverse Course. We will link to that also.
The producers of the Ralph Nader Radio Hour are Jimmy Lee Wirt and Matthew Marin. Our executive producer is Alan Minsky.
Our theme music, Stand Up, Rise Up, was written and performed by Kemp Harris. Our proofreader is Elizabeth Solomon.
Join us next week on the Ralph Nader Radio Hour when we welcome back Eric Steenstra of Vote Hemp and journalist Catherine Iban and her book, Bottle of Lies, about the generic drug boom. Thank you, Ralph.
Thank you, David, Steve, Jimmy. And remember, folks, we want to get single payer. It's Congress. That's what John Geyman's been fighting for and has offered his new helpful book, Struggling and Dying Under Trumpcare, How We Can Fix This Fiasco. We the people, turning Congress around. Unbeatable. Thank you.
Hi, this is Jimmy Lee Wirt, producer of the Ralph Nader Radio Hour, and welcome to the wrap-up, where we talk a little bit more to Dr. John Geyman and a whole lot more to Professor Ben Burgis. But first up is a special bonus guest.
So we have on as a special bonus David Helvarg, who's been on our show many times before. He is the executive director of Blue Frontier, whose mission it is to raise awareness of the plight of our oceans and offer solutions to those problems to the marine conservation community. Mr. Helvarg is the author of 6 books on conservation topics. He's the editor of the Ocean and Coastal Conservation Guide and also the organizer of Blue Vision Summits for Ocean Activists and the Peter Benchley Ocean Awards. Today, we're going to discuss his latest proposal, putting the blue in the Green New Deal. Welcome back, David Helvarg.
Thanks.
Welcome again, David Helvarg, founder of the Blue Frontier campaign. You've shown how not only oceans are critical to planetary survival, but they're very interrelated with coastal areas, with rivers, with streams, with estuaries, with lakes. And you've lived many, many an hour in the ocean itself, exploring it, scuba diving, sailing. You're a great leading advocate of recovering our oceans. And that's why I just want our listeners to understand what you're doing in connecting with the Green New Deal proposals in Congress. You want to put the blue in the Green New Deal. And can you briefly summarize what you mean by that and how essential it is for the Green New Deal to be effective?
Sure. I think, Alexandria Ocasio-Cortez and Ed Markey, who's one of our past Peter Benchley Award winners, when they introduced the Green New Deal, it's very aspirational and it's gotten climate front and center in the 2020 elections, which is important. But there's got to be a lot of backfill. Over 44% of the public is living in coastal regions, and the impacts of climate in terms of the ocean are so significant that we can't really have a Green New Deal unless we have a ocean climate action agenda. And so essentially, Blue Frontier partnered up with the Center for the Blue Economy at the Middlebury Institute for International Studies down in Monterey. And we came out with this agenda, which we're now trying to get the word out to policymakers within the marine and maritime communities and among various coastal groups, that the Green New Deal is great in terms of we really have to have a triple bottom line linking the environment, the economy, and equity. But, there's got to be a political platform and a legislative package to actually help recover the ocean. I mean, the federal government, despite the administration, put out a good, strong report last year on what's needed and what the state of climate impacts are. They said if we did the best mitigation, we could reduce 50% of the dangerous impacts of climate change in our coastal zones. We believe with our 8-point plan, we could get significantly above that. Of course, if you're in a hole, you have to stop digging. And the Ocean Coastal Action Plan is a combination of both reforms that are needed and directions that we need to take for a rapid transition off of fossils and on to renewable energy. But very basic stuff, like we've got a terrible federal flood insurance program that encourages people to rebuild in harm's way. We need, if we're talking about $1 or $2 trillion of infrastructure, we need to talk about living infrastructure, about restoring healthy habitats along the shore that, like we're doing in Louisiana and elsewhere, that protect the shore. And also programs like New Jersey has a program to buy back high-risk properties at pre-flood prices and then tear down those properties and build in parks, coastal parks, and habitats that can act as buffers before the next storm hits.
David, how do people get the 6-page putting the blue and the Green New Deal with these very concrete proposals, one of which I want to ask you about?
Sure. We're going to publish them on our websites, but right now it's published online at Manga Bay. If you just go, which is a science and conservation journal online, if you just go to Manga Bay and look up Putting the Blue in the Green New Deal.
How do you spell that?
MONGABAY, one word, Manga Bay. And we've got hard copy that I'll be giving out this week to members of various committees and subcommittees on the Hill. But people can find the original article at Manga Bay. We went there because they don't have the 6-month peer review requirements of a lot of academic journals. We've started talking to people like, friends on the Hill, like Senator Whitehouse and Brian Schatz's office and others. And we're seeing 1 or 2 areas where there's bipartisan support. But to get the full package through, we're going to have a new political administration. This one won't work on these.
Also, listeners, you want to get access to what David and his associates have been doing over the years on ocean conservation. David is the executive director of Blue Frontier. The website is www.bluefront.org, BLUEFORNT.org.
Right. And like last June, we chaired the first global March for the Ocean that took place in 26 nations around the world. On this June 8th, I'll actually be joining the New York Aquarium on their second March for the Ocean on the Coney Island Boardwalk, which is kind of my natal waters.
June 8th is Ocean Day, right?
June 8th is World Oceans Day. The UN declared it, and we're acting on it by mobilizing people to march around specific issues like ending offshore drilling and plastic pollution and responding to the climate threat. I mean, the scary thing is, since I was a kid watching Sea Hunt and Jacques Cousteau specials, we've not only polluted and warmed the ocean, we've changed the physical nature of the ocean. Today, its circulation, its chemistry, its temperature, even its color are changing because of human inputs. And so the IPCC, the International Panel on Climate Change, has said we've got now basically 11 years to hit a stage where we're 50% non-fossil fuel if we're going to stay below 2 degrees Celsius warming, which would be catastrophic. And in the ocean community, the science community, the direct experience community of people living in places like Louisiana and Florida and California, we're seeing the impacts. So we need big comprehensive approaches. And we're not just saying the Blue New Deal, we're saying make that part of the Green New Deal and incorporate with agricultural reforms and regenerative soils and replanting of forests so that we can start taking carbon out of the atmosphere. We just had our first last month in Texas. We had our first Inland Ocean Action Summit with over 100 people from over a dozen interior states, including farmer from Iowa and scientist from Montana, but talking about how all the waters are connected in the watersheds.
If you want to connect with all these things David's talking about, and he did a directory of citizen groups all over the coast, Atlantic, Gulf, Pacific, all dedicated to protecting, saving the ocean. Go to bluefront.org and you'll connect with people like you. You heard him just say 40% of all people in the United States are on the ocean interface. 40%, and a lot more are affected inland as well. So the thing that caught my eye in your 6 pages, the failure in the wake of 2017's Hurricane Maria not to transition Puerto Rico's energy grid into a decentralized solar-based system that would be impervious to future climate shocks, but rather to rebuild the fossil fuel-heavy status quo, is a telling example of our present climate planning failure and an example of what the Green New Deal can transcend, provided it incorporates the blue economy into its legislative and policy plans, end quote. You want to elaborate on that?
Yeah, just every disaster is an opportunity. And unfortunately, we're getting more and more opportunities to transition. We know what the solutions are. We even know the energy models. We've just reached the point in the last few months where there are more people employed in renewable energy in the US than employed in coal and offshore oil. The market signals are there. We need the political signals to follow, and we need some programmatic approaches. So we're not saying we have all the answers. What we're saying is we're going to meet again with leading folks from many communities in September in Monterey, and the next spring we'll come to DC and hopefully sit down with policymakers and say, how do we turn these proposals, not just an action plan, but packages of legislation that would benefit the great majority of people who are either living in our coastal zones or impacted by changes in our ocean? And who's impacted by the changes in the ocean, of course, is everybody. I mean, this is where we get half the air we breathe and much else, from recreation, restoration, trade, transport, just that connection to every part of the water cycle.
So listeners, if you're interested in the cause, June 8th, World Oceans Day, and go to bluefront.org for schedules, all kinds of events, where they occur, how you can connect right where you live and work and raise your families. Thank you very much, David Helvarg, Executive Director of Blue Frontier, an ocean conservation and policy group extraordinaire.
Thank you, Ralph. You're an inspiration and also a founder. Take care.
Thanks, David.
Thank you, David. We've been speaking to David Helvarg, Executive Director of Blue Frontier. Go to bluefront.org.
Now, Steve asks another question of Dr. Geyman about premiums versus taxes.
I wanted to jump in here. I know somebody they're basically a private contractor, clinical psychologist, has his own shingle. He pays $25,000 in premiums for his family for healthcare, plus a $4,500 deductible. So that's close to $30,000 a year for healthcare. I can't imagine that if a single payer system was put into place, his taxes would exceed $30,000. They would increase that much. Can you give us a perspective on that, either Ralph or Dr. Geyman?
Yeah, individuals and families will save hugely under Medicare for All.
You say 95% will pay less.
Yeah, 95% will pay less. It's in my book, the exact numbers by income level.
But it's pretty reasonable to say that, this person I'm talking about, his taxes will not increase per year $30,000.
Oh, no, they'll go so
this.
far down, they'll be very minimal.
Because it seems like that's the point that has to be made, because the bogeyman is you're gonna pay more taxes. Well, compare that to the premiums you're paying now. And if those numbers can be sussed out on a point-by-point basis, I think the argument on a mathematical point of view is won.
Well, here I've got the numbers here. If you have an annual income of $50K, you'd pay $1,500 in taxes. a year.
Wow.
Yeah.
If you have an income of 100,000, you'd pay 6,000, and if 200K or more, you'd pay 12,000. So,
and that's assuming you're not sick and paying the bills, because
right,
if you get sick under single payer, there are no waivers, no exclusions, no co-pays. You save enormous.
So none of those numbers come close to $30,000.
No.
You'd have to be making, tons of money, which then you could afford if it was that. So, okay. I just wanted to make that point.
George Lakoff would tell us to start referring to it as the health insurance tax, so that we could frame the argument. Say, how much is the health insurance company taxing you each year?
Right.
And here, Ralph, David, and Steve continue their lively discussion with Professor Ben Burgis, where somewhere along the line, David asks Ralph why he doesn't call himself a socialist.
Thank you very much, Ben Burgis.
Thanks, Ralph. It's an honor. I voted for you twice.
Thank you. What happened the third time? I can't wait for you to debate Ben Shapiro.
Yeah, absolutely. I'd love that.
By the way, have the Student Lecture Bureau make the invitation and put out a press release so that the New York Times gets it, and, the Trenton paper and so on, Newark News. And if he turns it down, he's like a coward, right?
Yeah, absolutely.
I want to ask a serious question, because this is way out of my league. I know that Steve has struggled with this because you wanted to do a debate show.
Yeah.
Right?
Yeah.
And when I can't watch any of these shows, and even these big debates between Jordan Peterson and CSEC, they're boring and there's no judge. And when I was listening to Ralph as the Grand Inquisitor with you, shouldn't the format of a debate be more about the inquisitor, the moderator who is enforcing the rules and cutting them off, being impartial, but making sure they're debating, obeying the rules properly and not going off on tangents? That, to me, is why debates are boring. And
here's my problem with that. I get the appeal of it, but we were just talking about the problems with big corporate media and their ideological assumptions. And so the more, at least if we're talking about mainstream media outlets, the more you empower the moderator to cut people off, redirect the course of the conversation, the more everything is on the terms of their worldview. And I think that might be more of a mixed bag than you're making it out to be.
Well, I'm just saying, in terms of arriving at the truth, if Ralph Nader, for example, were the moderator of a debate between you and Ben Shapiro, or not even Ralph, I'm just saying, if you had a wise moderator who was enforcing the rules, you could arrive at a truth. You do that in a jury trial. You need a judge to cut people off.
Because I think you're right. Our experience with the taboo displayed that, David. We didn't really have a Grand Inquisitor, as you say. Ben Burgis, what are these new magazines that are gaining attention and circulation in progressive circles? One is called Current Affairs and the other is called Jacobin.
Yeah. So they're slightly different kinds of magazines, but I think they both do a lot of really good work and they're both well worth reading. They both do print editions, but in both cases, you can read the vast majority of the articles online. So Jacobin is edited by a guy named Bhaskar Sunkara, who also has a new book out, which I'd strongly recommend, called A Socialist Manifesto. And it's published a lot of, I think it really kind of hit its swing during the 2016 primary, because a lot of the sort of left wing of pro-Bernie people were reading it, and it sort of influenced a lot of people's thinking about the primary. Current Affairs is edited by a guy named Nathan Robinson, who blurbed my book. I was happy about that. And it's a slightly different kind of thing, but I actually really like Current Affairs because it's has a very analytic kind of style. They do a lot of the things I recommend in the book about breaking down arguments and instead of instead of just saying, Ben Shapiro is a charlatan and a racist and all this stuff, which might be true, but that doesn't really convince anybody who doesn't already agree with you. Nathan Robinson in Current Affairs will do things like write a 10,000-word essay where he really takes apart in detail a lot of what's wrong with Shapiro's ideas, and and he really gives an argument against it.
I ask you this question, Ben Burgis, because I found a lot of progressives don't read their own materials. That is, they don't read each other's books, each other's articles. I can't tell you how many progressives have never signed up to read my weekly column at nader.org, and it's free, and they get it automatically, and it would considerably expand their knowledge base, their insight base, and their motivation base, if I do say so myself.
Because they're not leftists.
So listen up, listeners. These are two good, interesting publications that may not have come to your attention. Okay, thanks a lot, Ben.
All right. Thank you so much, Ralph.
Thank you, Ben.
Thank you, Ben.
Thanks.
Ralph, can I ask you a question? There is a difference between progressives and leftists. Why do you cling to progressive and not going all the way to calling yourself a leftist?
Yeah, because the left gets pigeonholed just the way the right does, and they're not always right and they're not always left. So progressive argues on the facts wherever they may fall. So it's not a pigeonholed ideology.
And in the left-right alliance, you examined all the political philosophies that led to...
There's a lot of baggage to the word left and right. A lot of baggage. It's too categorical for an evidence-based mind.
You were never tempted by Marxism when you were young?
No, because there are too many premeditated positions. That's why people say neo-Marxists, or, I'm a modern Marxist. When somebody says they're a Marxist, all I think of is they pay a great deal of weight to economic aspects shaping political and economic reality.
Well, how about...
And concentrated power. The point is, power can be corrupted regardless of whether it's public or private. And we have plenty of history to demonstrate. So once you pigeonhole yourself, you don't want to admit one or the other. When you say you're a capitalist, Wall Street is always right. When you say you're a socialist, you're often pigeonholed, say government is always right. And that's not true. Concentrated power, wherever it is, produces abuses, no matter what its configuration. And that doesn't mean they're all on the same plane of abuse in any given time in history. No, they're not. Like right now, corporate capitalism is producing the most horrendous prices to the accumulation of profit in the history of capitalism. Empire, domination, destruction of freedom of contract, perpetuation of poverty. Those are the prices of profit. And nanotechnology, biotechnology, unregulated. Artificial intelligence, unregulated. The price of corporate profit is staggering. And that's not true in socialism anymore because they're not in charge.
And that's a wrap. Join us next week on the Ralph Nader Radio Hour. Thanks for listening.
Stand up, you've been sitting right.